पिछले ये इनकी 8 ईयर चल रही है पीएचडी की, और इस साल इनका सबमिशन फाइनल हो जाएगा पीएचडी का। मैंने ईआरपी पे काम किया, इवोक द रिलेटेड पोटेंशियल पे। डायबिटीज का प्रोजेक्ट था जो डॉक्टर दीपेश्वर सिंह की। बाकी हमारे जितने भी मेरे एक्सपीरियंस रहे हैं, जैसे मैंने बुद्धि भैया के बारे में बताया था आपको, जैसे बुद्धि भैया हमारे वन वन ऑफ द बेस्ट स्कॉलर हैं, उसी तरीके से अमित भैया भी हमारे वन ऑफ द बेस्ट स्कॉलर्स में आते हैं यहाँ पे। तो अमित भैया का मैं वेलकम करता हूँ। आज हमारा वेरी वेरी इंपॉर्टेंट टॉपिक है रिसर्च डिजाइन की। प्लान कैसे करें हम रिसर्च को, किस कैसे ग्रुप लें। तो बहुत सारे बच्चों को डाउट्स रहता है उससे रिलेटेड, कंट्रोल ग्रुप, एक्टिव कंट्रोल ग्रुप, उनको लेना चाहिए कि नहीं लेना चाहिए। तो ऐसे छोटे मोटे बहुत सारे डाउट्स जो हैं आपकी सिनॉप्सिस प्लानिंग में यूजफुल होने वाले हैं। आज अमित भैया आपको उसकी क्लास लेने वाले हैं, तो मैं वेलकम करता हूँ अमित भैया का। तो प्लीज भैया आप अपना शुरू कीजिए।
ओके, थैंक यू सो मच राहुल, उतनी तारीफ के लिए और फॉर इंट्रोड्यूसिंग मी to this August audience. So first of all, I apologize for the delay. Yeah, a few minutes of delay from my side, and I'm really sorry for that. So as Rahul said, like I cannot call myself as a doctor yet because my defense is not yet, but I have submitted my thesis. And my area of work, of course, my area of work involved diabetic population, but basically it is concerned with cognitive science or cognitive neuroscience. Okay, so I won't go into much details of my own study. We can, I can answer your questions if you have any questions regarding that later. Okay, so shall I formally begin today's session? Anyone? Yes or no? Something? Okay, I think.
Yes, sir. Yes, sir.
Yes, sir. Yes,
I
sir.
think. Okay, thank you for that response. I think everybody, I assume that everybody is able to like listen to me, and I am also getting responses and charts. So thank you. So as you know, we are basically trying to understand research designs, okay, from yoga perspective. Okay. Now, so this is the word that you should keep it in mind. Research designs in the context of yoga research. So why I'm emphasizing this thing is basically because the way I planned today's session is keeping in mind only yoga research. Okay, when you talk about only research designs, okay, it's a very vast subject. It has a very broad spectrum. Okay, so it includes research design for humanity studies, for social science studies, for life science studies, uh, for market studies. Okay, are very different. Okay, so research design as a subject, as a topic is very broad, that has different utilization according to in which your field you're using it. Okay, so I have restricted today's session of research designs to the yoga field. Okay, one thing. So again in yoga field, what I felt was to introduce you the different kinds of research designs that have been generally used so far in yoga research. Okay, one thing. And second, uh, how these research designs have been useful so far in understanding different aspects of yoga. Okay. So these are the two things that I kept in mind, that to introduce the concept of research designs and types of research designs within the framework of yoga research, within the context of yoga research. Okay. So one thing is that. Second thing, I want you to know that the sessions that we are going to have today, or the things that you're going to see in my slides today, are not from any textbook. Let me be very clear and blunt about it. Okay. So that is sheer from the experience of my research journey. So you may ask why I did that. Okay. So I want you to know about this because you later on you may say that, oh, this is wrong, or this you haven't told this thing to us. So to avoid all those confusions, what I did was I just have listed down those research designs that have broadly been used so far in yoga research. Okay. And why I done that? Because whenever you read research, you all are aspiring research students. Okay. So whenever you come across any research paper or any research methodology lecture for that matter, or when you plan your study in yoga, okay, more or less broadly, you are going to use these designs, one thing. Second, whenever you do your literature review or when you try to read yoga research, different research papers, more or less you will come across these research designs. So from a practical perspective, it makes sense for you to understand those terminologies that you're seeing again and again and again in research papers. Okay, so keeping all these things in mind from a very practical point of view, okay, I have designed this session sheerly out of experience and not from the textbook. Okay, or else I can just note down the research designs and tell you what each design is. That you will get to know even if you Google it. Okay, so I didn't want to give you here the Google knowledge or any textbook knowledge. Okay, I wanted to conduct this session in a way that will be more practically be useful for you. Okay, so I think I have conveyed the objective of this session quite well. With that assumption, I'll just move ahead. Okay, I'll just share my screen so that slides are visible. Are my slides visible?
Yes, sir.
Okay, thank you. Okay. So when we talk about research design, so let's understand first what is research design. Okay. So you may read out these lines, whatever written here. Okay. The process of planning the execution of a research idea, the process that provides logical flow to your research idea, or the process that helps you to understand whether idea can be executed within the framework of research. So this is from a very practical point of view. So when you say that you want to conduct research, okay, and you do research when you have some idea, okay. So the basic question arises whether your idea is worth enough or practical enough to conduct a research on that idea. Okay, I hope you are following me. Okay, so for example, I want to know if one yoga asana, okay, for example, one pranayama, Kapalbhati pranayama, okay, when I practice that pranayama, okay, I want to know what happens in my mind immediately after I practice my pranayama. Okay. So if you want to do research on that, you will start finding ways to answer that question. So there's a difference between an idea and an idea that you can research on. Okay. An idea can be your curiosity as well as an imagination. Okay. But that does not necessarily mean that that idea can be worked in a way that you can provide some evidence for it. Okay. So when the question of research comes into picture, what's the use of research? What's the purpose of research? The purpose of research is basically to establish an evidence quantitatively or qualitatively. Okay, establish an evidence so that you can generalize it. And why there is a need to generalize? Because so that it can be useful for the society, right? So when there is an idea that you want to research on, so that you can generalize it. So how you can generalize it? You can only generalize it only when you follow certain process. What is that process? That process itself is research designing. So what all it contains? it contains the process of planning the execution of your research idea. Okay, so as I said, you want to know how the practice of Kapalbhati impacts your psychological health. Okay, so you want to do research on it, right? Hypothesis, for example, right? So research design, the concept of research design help you to understand how you can execute this research. Okay, planning a research is one thing. Okay, like having this idea that I want to see this. This is one thing, right? But how to do research about it is a different thing. And that's what research design helps you to do. Okay. And the process of providing a logical flow to your idea. As I said, an idea, just an idea can be your imagination or just a curiosity also. But you cannot do research on every idea that you get in your head, right? So having a research design helps you to think of your idea in a logical way and reaching to a logical conclusion with your ideas so that you can establish an evidence and make it useful for the society, right? And this is the beauty of research, that since you're putting out the facts, since you're proving your point with the data, okay, it makes the acceptability of this topic of your point broad. Like society can accept your point of view very easily because you're putting out facts. So irrespective of the caste, creed, language, tradition, culture, everything, the research helps society to accept these things because you're not putting any bias there in front of them, right? So that's the second utility of research design. One, taking your idea from a conceptual level to the execution level, one thing. Second, when you have an idea, again percolating, again repolishing that idea, revisiting that idea in a way that you reach to a logical conclusion from that idea. Okay. Third thing, as I said, providing a logical flow to your idea means a research design, thinking of research design with respect to your topic will help you to understand whether your idea is executable or not. Okay. So these are the three utilities of research design. Okay. So now the purpose of research design. Okay. You may see these points a bit repetitive, but there are differences in nuances of these things. Okay. As I said, fundamentally turning your idea into research idea. So when we say research, right, we always emphasize on the point that your idea should be worth enough to research. We generally say it, right? But how do you come to know that whether my idea is actually executable or not? Well, if you have certain idea about research designing, you will be readily able to imagine your idea as a research idea. So if you have that knowledge of research design, okay, it will help you to understand your idea in a way that you can execute upon it. Okay, and if you have statistical knowledge apart from research design or along with research design, okay, that will concretize your idea even more. Okay, that increases the probability of execution of your idea. So that's the benefit of knowing certain things in research in the beginning itself. Okay, so like usually what happens when you enter into PhD and go into coursework, you learn those things there, or even in your masters in some cases, right? So, but if you don't know about research design or some basic statistical understanding, right, it is difficult to an extent to imagine your idea as a research idea. Okay, so in that sense, research design is very helpful. And again, when you think of your idea, when you think of executing your idea, you actually don't know what are the factors that can influence your idea when you try to execute it. You can sit on a drawing table and see this is what I planned and this is how it will work. sitting on a drawing table and planning it out or writing it out or preparing a design about preparing a slide about it is very easy. Okay, but when it comes to execution of research, it's a different ball game altogether. Okay, so as carefully you think of your design of your research or you think of executing your research, you will be able to control many surprises in the execution of your research. Okay, for example, if you want to do a study on effect of yoga, for example, on hypertension. So if a hypertensive patient does yoga, okay, what the benefit will that patient get, right? If that is the question that you want to address, okay, and you simply give practice, same practice to 3 people who have hypertension, okay. Now imagine 2 situations. One situation when you know little bit about research design, okay, and one situation you have no idea about research design, okay, 2 situations. So when you don't have any idea about research design, what are you going to do? You will simply give the same practices for say, for example, for 1 week to the 3 people in the same way, okay. But when you have an idea about little bit idea about research design, what are you going to do? You will see that whether the characteristics of these 3 people are matching or not. Okay. For example, if one person have only hypertension, but if the second person have hypertension and diabetes, right? And if the third person have hypertension along with some heart problem, right? So characteristics are not matching, and this comes as a surprise. Okay. And if the characteristics of these 3 people are not matching, you cannot generalize your outcome, even if they got benefited. For example, these three people had different characteristics. Even if their hypertension was reduced, you cannot generalize your result, because you cannot say कि 3 different people practice and this is the result. You cannot say that because characteristics are not matching. Okay, you can generalize your results only within certain framework of conditions, and that's how research works. So when you generalize your result, it's like putting an advertising banner, get 50% off, okay, but there is a small written star terms and conditions apply. Like that, we say yoga benefits to help your glucose, lower your glucose levels or lower your BP levels, okay, in certain conditions or in certain patients or in certain age group of people. So these are the things that are like star terms and conditions apply. Okay, so the idea of reducing the surprise elements in your execution of research, okay, the idea of knowing or imagining or already assuming that these are the things that can surprise us, or these are the things that can influence our study, okay, and if these are the things that can influence a study, how can we reduce them or control them, or how can we get rid of those things? Okay, so to understand all these things, understanding research design is very essential. And basically, this is what research design is. Basically, planning and understanding what your planning is executable or not, and you execute in a way that you reduces the surprises or the factors that can influence your study to the maximum level. Okay. And second thing, generally, when you imagine that you're already doing a research, okay, you have some research project in your hand, and you're doing a research, okay. Generally, it happens that when you're so deep in your study or executing the project, you just go in the flow of that project, okay, in a way that you forget the fundamentals of your project. Sometimes it happens, okay, in real life. So going back to the table and looking at your research design, what have you all chalked out or planned out, right? Having a look at it during some in the middle of execution of your research will help you to stay on track. No, this is the thing that you have to do. It's the thing. So You should not deviate from these points. Okay. So it's sort of a reminder for you that what is the framework of your research study and what you should focus on so that you are not deviated as such. Okay. So basically, the research design, you can understand research design as something that helps you to understand whether your idea is researchable or not, and how smoothly you can execute your research. That's all a research design is. Okay. So I am assuming that I'm not very complicatedly explaining it. Okay. So till here, till this stage, I right now stop here. Okay. I'll come to the types of research design a little bit afterwards. I want to know whether understanding the research design, is there any question about it? We'll come to the types just after a few minutes. If you have any questions till now, just ask me that.
Sir,
Yes.
sir, research design, research
Yes.
method और research methodology,
Okay.
इसको थोड़ा सा differentiate कर दीजिए, बड़ा confusion होता है इसमें.
Research design, research methods,
And methodology.
methodology. Okay. So research methodology is a very broad term. It encompasses very broad as like entire aspect of research. Okay. Whatever is involved in research, everything comes into research methodology. Okay. And research design and research methods, okay, are pretty much similar. In a sense, you can understand it as probably the same thing explained in different manner. For example, when we talk about research design, okay, what are we talking about? We are very concentratedly talking about how many groups you should have, okay, and how they should be divided, okay, and what should be your sample size, when should be the assessments to be taken, okay. This all includes in research design. When you talk about research methods, okay, it includes some of the aspects like what is the aim of your research, what is the objective of your research, what is the hypothesis of your research, okay, and what you anticipate your research outcome will be. That's like hypothesis. How do you envision your research? So research method encompasses all these things along with research design. Okay, but research design is dependent on your research question, your aim and objective, and your hypothesis. Okay, based on these things, you design your study. Okay, so that's what a research design is. Okay, research methodology is basically everything about research.
Thank you, sir.
Okay. Anybody else? Okay, I'm assuming there are no questions. So I'll just move to next slides. So I have just named, is it audible? Is it visible? I guess it is.
Yes, sir.
Yes, sir.
Thank you for the response. So these are the common research design terms that you will come across in research papers. Okay. So understand when you talk about research design, basically there is two kinds of researchers. I don't know whether you guys are familiar with this or not, but I'm not getting into detail. One is something like quantitative research, and another is like something called like qualitative research. Okay. In quantitative research, you deal with the quantitative data. In qualitative research, you deal with the qualitative data. Okay. So what I have listed here are quantitative research designs. Okay, those involve that quantitative research. Okay, I have not dealt anywhere with respect to qualitative research for simple reason that in yoga studies, we are not yet used to design qualitative studies, or more or less, we have not, as a yoga community, we have not much focused on using qualitative research in yoga. Okay, there might be many reasons. Different people have different reasons, but quantitative research designs have taken more dominance in the field of yoga research. Okay, and as I said earlier, I wanted to introduce those terms that you will often see when you try to read research papers. Okay, so these are the terms: cross-sectional study, crossover study, RCT, randomized control log. RCT is something that you will very often listen to it, okay, or get to see it. Longitudinal study, self-first control design, correlational study, quasi-experimental design. And the last two things, systematic review and meta-analysis, these are not exactly research designs as such, okay? But why did I include that? I'll come to that later, okay? Now let's have a look at them. First one is cross-sectional study design. So what does it do? Basically, in this design, you have two or more than two groups, okay? So in research, there are two terms. I again do not know whether you know it or not. One term is population. The other term is sample. Okay, these are two different terms. Okay, population is not equal to sample, and sample is not equal to population. Okay, but sample is a representation of a population. Okay, for example, if there are 10,000 people, diabetic people in one city, okay, in one single city, there are 10,000 diabetic people. So if I want to do a research on diabetic people in that city only, anything, I might be checking their EEG, ECG, or blood sugar level, whatever, okay, or even weight or height, anything, okay. So what I'll do is, I'll take probably around 50 to 100 people from the same city, 50 to 100 diabetic people from the same city. Now that 50 to 100 people are my sample, okay, which represent, those 100 people represent the 10,000 people. Okay, I'm giving you hypothetical numbers, don't take it literally. Okay, I want to make it clear to you that what is population and what is sample. Okay, because this is essential to understand different study designs. Many people get confused here itself because they simply don't have a clear understanding of these two concepts. Okay, sample is representation of a population, meaning if I do research on these 100 people, okay, I can apply or I can generalize the outcomes of these outcomes of this study that I conducted on 100 people. I can generalize these outcomes to those 10,000 people. For example, if I say that pranayama 1, 2, 3, and 4, okay, are most beneficial yoga practices for diabetic patients in this age group, okay. So for example, this is my study that these four pranayamas, pranayama A, B, C, D, are the most effective yoga practices for diabetic. Okay. Then I did the research on those 100 people. That was my sample. Okay. But this outcome of my study that these four pranayama are most effective, I can generalize this statement. I can say that these four pranayamas also applicable to those 10,000 people out there. Why I can say that? Because the sample represents those 10,000 people. Okay, so this is the difference between population and sample. So in cross-section study, what happens? There are two groups that come from two different population. Okay, this is essential. Two different population, meaning one group of people have entirely different characteristic, another group of people have entirely different characteristic. For example, one group is of diabetes, one group is of hypertension. So diabetes is not same as hypertension, right? So two different characteristics means two different populations. Okay. So what does cross-sectional study do? It compares two groups or more than two groups at one point of time. Cross-sectional study, in simple terms, do not involve any intervention. Okay, it's only comparing at one given point of time, right? For example, I want to know it can be used only to compare several parameters. For example, I want to know that what is the stress level of a diabetic patient and what of a hypertensive patient. Okay, this is my question. So what I will do, I'll bring diabetic patients and hypertensive patients. I'll probably take their EEG or give some questionnaire and ask them to rate the stress levels. Okay, and they will rate the stress levels. And I simply take those data and compare who have more stress levels, right? So there is no intervention involved here. I simply want to know what is the situation right now. Okay, so for example, severity of the disease, so after 5 years of diabetes or after 5 years of probably stroke or probably depression, right? So after 5 years of diabetes and one group after 5 years of diabetes, the other group after 10 years of diabetes. Okay, so now you may ask, but both the groups are diabetic people, right? But one group has a disease duration of only 5 years. The other group has a disease duration of 10 years. So there's a difference here. They have two different characteristics, and you want to see what are the probably the cholesterol levels in 5 years diabetic people and cholesterol levels in 10-year diabetic people. Okay, so cross-sectional study involves comparing parameters between two different or more than two groups, different groups, comparing parameters in those groups at one point of time. You take their assessment only once. That is cross-sectional. Now, what is crossover? Okay, crossover is similar to cross-section in the.
Sir, can I ask one question in this only so that I will clear? Sir, we can't use this in experimental research, cross-section design.
No, you can't use it, but there is a, sorry?
Only in theoretical research.
No, you can use it. So when I say, for example, when I say that what is the cognitive ability of a healthy person and a person who has depression, right? So this is an experiment. Okay, this is an experiment. So basically what you will do, probably you will take an adult, you will take adult group who is probably 40 to 50 years of age in this age range, and you will assess their cognitive ability, their memory, their attention level, all those things. And you will take depressive people who are in the age range of 40 to 50 years. You will also assess their memory and attention level, all those things. Okay, you will take that assessment only once. Okay, and you will do the statistical analysis and compare these two groups, right? So this is also an experiment. Experimental study does not, this word, experimental study word does not necessarily mean that there should be a pre-post design. It does not necessarily mean that there should be some parameter that you should assess before giving any treatment and you should assess it after giving any treatment. That is only experiment. No, it's not like that. Experiment, what does it mean? Basically, understanding a phenomena. Okay, and you have different ways of understanding certain phenomena, and that's what research design is. You, with these different kinds of design, with different methods, you understand different phenomena, right? So,
Okay, sir.
am I clear?
Yes, sir. Yes.
Okay, so I'll go ahead. So crossover study design. Okay, crossover study design is similar to cross-sectional. Okay, but the only difference would be that there will be multiple treatment modality involved or interventions involved. Okay, for example, if there are two groups, okay, then what happens is here, even if it is one group or two group, sorry, it should be more than two or more than two group. Okay, what happens is there are two interventions. For example, one is yoga intervention, one is exercise intervention. Okay, now what you will do, you will tell one diabetic group, okay, one not, both of them will have both of the characteristics will be same. So meaning the sample will come from the same population. Okay. For example, if I take diabetic people, okay, all of them in the both the groups, okay, they will have diabetes. Okay. But the order in which they will receive the treatment will be different. Okay. For example, if I have 3 different treatments, one is yoga, one is exercise, okay, and one is probably what, diet therapy, okay. So I'm giving 3 different therapies, okay. And what I'm telling these diabetic people, for one person, we will randomize here the interventions, not the people. It is a bit complicated to understand. You have one group, understand like this. You have one group of 50 people, okay, who have any disease. For example, take any disease, okay. And you want to know how yoga works on them, how exercise works on them, how diet therapy works on them, okay. So what you will do, that you will randomize the interventions. So for example, participant number 1, okay, he will receive first yoga, then exercise, then diet. Okay. Participant number 2, he will receive first exercise, then yoga, then diet. Participant number 3, he might receive diet first, then exercise, then yoga. Participant number 4, he might receive exercise first, then yoga, then diet. Okay. So each and every person will not go undergo in the same sequence of interventions. Okay. The sequence of taking the treatment will be randomized. Okay. So that is crossover design. So what do you achieve by this design? You'll basically be able to see that the effect of each intervention on the subject, the effect of each treatment line on the subject. Okay. So this research design, this study design will basically help you to understand the effect of each treatment, as opposed to randomized control trial, or what you call as quasi-experimental design. Okay. So there, one group will receive only one treatment. Okay. Here it's not like that. If there are 2 groups, both of them will receive all of the 2 or 3 treatments. Okay. As opposed to quasi-experimental or RCT design, wherein one group is supposed to take only one intervention. Whereas in crossover, each participant will undergo all the interventions. Okay.
Sir, how assessment will be done? Like how will finally analyze it? Because
Okay.
everyone is getting all the other, all the 3 types of this settings.
Yes, that's a good question. What happens is, when we make participants to undergo all interventions, for example, there are 3 interventions. And for example, if I am giving each treatment for one week, okay, so there's something called as washout period. Okay. So what we do, if a person first taking exercise, okay, he will follow that exercise for 1 week. Okay. After that, there will be a gap of about, for example, 15 days. Okay. So in those 15 days, that person won't follow any treatment. He will be just normal in his life. After 15 days, he'll follow, for example, yoga for 1 week. Okay. So before starting exercise and after finishing, after 1 week of exercise, there will be pre and post assessments. Then 15 days gap. Okay. Then again, before starting yoga and after 1 week of practice of yoga, you will take assessment. Then again 15 days gap. Then again, there will be a pre-assessment before starting diet therapy and after finishing diet therapy after a week. Then there will be a pre-post assessment. So in this way, you will come to know that how each treatment has affected a particular participant or an individual. Okay. So this is how it will go.
So for all the three types of settings, there will be different groups, like for 10 people in one group, 10 in second or 10.
Yeah.
Okay.
So here what happens? You may in crossover study design, there are 2 or 3 possibilities. Okay, I'll come to that later because it will make your understanding more complicated. I will come to that point later, but I'll definitely address this point. Basically, in crossover study design, your sample is from the same population. Okay, the example that I gave you right now of 2 different groups, that will have some mixed designs. Okay, I shouldn't have given that example because that complicates your understanding, but I'll address this later. In crossover study design, what happens? Your sample are from the same population. Okay, so you consider this as having only one group of people undergoing different interventions. Okay, the example that I gave of 2 groups basically involves not only crossover study, it can have multiple designs intermixed in it along with crossover study design. I will address that later. Okay. For only crossover study, you understand that there is one group. There is only one group of people. They are going under different interventions. Okay.
Yes, sir.
Okay. So now next randomized control trial. So I'm sure many people have heard about it probably, and many people might have like seen in this paper, right? So randomized control trial. Basically, you have population, you have sample from the same population again. Okay. For example, you cannot have one group of diabetic people, one group of hypertensive people, or you cannot have one group of healthy people and one group of depressive people, or one group from back pain, one group from low back pain, and another group from kidney problem. You can't have 2 different groups. You can have 2 groups of diabetes, 2 groups of low back pain, right? 2 groups of with liver or kidney problem or with GIT problems. Meaning 2 or more than 2 groups should belong to the same population. That's the condition of an RCT. Okay. But if they belong to the same group, how do you divide them into different groups? You divide them randomly. Randomly meaning that as a researcher, you also don't know which person will fall into group 1, which person will fall into group 2, which person will fall into group 3, because it is random. Okay. And how do you divide randomly? There are 2-3 different ways. So one of the famous classical traditional method is lottery method. Okay. So what happens? For example, there are 50 diabetic people and you want to divide them into 2 groups. One group will take yoga and another group will take nothing. It will be just on medication. Okay. So what you do, you have all those 50 people and you have a chits written on them 1, 2, 3, 4, 5, 6. Okay. Or the group name written on them, yoga group, control group, like this. Okay. 25 chits written yoga group, 25 chits written control group. Or you might have given IDs 1, 2, 3, 4, 5, 6, and you might have in the backdrop, you might have written number 1 belongs to this group, number 2 belongs to this group. So if you want to make 2 groups and you have 50 people, it means each group will have 25 people, right? So each participant will come, pick up that chit and see what is his ID or what the group name is written on it, right? So whatever the group name comes in it, that person will belong to that group, like that. This is famously called as lottery method. Okay. So in New Age, what do? We just use computer to generate some random sequences. Okay. Meaning you tell the computer that I have 3 groups and I have totally, 90 people or 100 people with me. Okay. I want you to divide 100 people equally. I want to divide these 100 people randomly into 3 groups, right? So what it does, and you should mention whether you need a repetition of these things, of the IDs. You should say no, because each group will be different. Okay. You tell it and it will randomly allocate numbers to different groups. For example, if number 1 comes into group 1, number 4 might come into group 2, number 10 will come into group 3, number 2 will come again into group 3, but number 3 will come in group 1. So like that, from 1 to 100, it will randomly allocate different numbers to different groups. Okay, so what are those numbers? Those numbers are basically the participant ID or subject IDs. Okay, so now what happens? Whoever is recruited in your study, first, okay, you allocate that ID to that participant and you see where that first ID is located in which group. Okay, for example, if that first ID is located in a control group, then that person will belong to control group. For example, the second participant come, okay, and you see where that number 2 is falling. If that again number 2 falls in the control group, that person also belongs to the control group. Number 3, if that number falls into your group, then that third person will fall into yoga group. So this is how randomized control trial is done. Okay, this is how people are randomly divided into 2 or more than 2 groups. Now, why it is a randomized control trial? Because control means what? That you have a group to compare with. Okay, one group is practicing yoga, another group is not practicing yoga. So when you say that my yoga treatment is working, right? See, your yoga treatment is working, yes, but with respect to what? With respect to what it is working? You should have some other parameter to compare with, right? So if I say that my yoga treatment is working better than the modern medicine treatment, okay, my yoga treatment is working better than the diet treatment, my yoga treatment is working better than the exercise, or yoga treatment is not better than the exercise, or it is equivalent, as useful as exercise. So basically, you should have something to compare with, right? So that is called controlled. Means you have one group that is controlled in a way that it is not following the yoga treatment. Since we are talking only in the context of yoga, I'll simply say yoga. Okay. So one group is practicing yoga, other group is not, because it is a control group. Control means what? You are requesting that group that you please don't practice yoga, for example, till 1 month. Okay. That in a way, we are controlling their environment. We are controlling their functions to some extent, not very hugely controlling them, controlling some extent. That's why it's randomized controlled trial. And that's why it is important that 2 or more than 2 groups, the samples in these groups should belong to only one group. Any questions for RCT? Okay. Yeah.
हरिओम सर। सर मेरा प्रश्न ये है कि कंट्रोल ग्रुप जो ले रहे हैं
जी।
और जो प्रैक्टिकल ग्रुप है, तो कंट्रोल ग्रुप को अगर बच्चों पे कर रहे हैं काम, तो बच्चों को कंट्रोल करना क्या मुश्किल नहीं होगा? क्योंकि बच्चों में क्यूरियोसिटी ज्यादा होती है कि देख के करना है, उनको हमने बता दिया, मान लिया उन्होंने कि हाँ ठीक है, हमसे तो कह दिया, लेकिन एक दूसरे डिस्कशन तो होते ही जो कर रहे हैं उनके साथ में किया और उन्होंने साथ साथ में करने लगे, तो फिर कैसे उस पे हम लोग कंट्रोल कर पाए?
ओके, सो इट्स अ वेरी प्रैक्टिकल प्रॉब्लम। ठीक है, कंट्रोल का मतलब आप यहाँ पे ना एकदम इसको लिटरली मत लीजिए कि हम उनको कंट्रोल कर रहे हैं। ठीक है, जैसे मैंने कहा कि फॉर एग्जांपल आपके पास, आप बच्चों का उदाहरण लिया आपने, हम एक बच्चों के ग्रुप को योगा कराते हैं, एक बच्चों के ग्रुप को योगा नहीं कराते। ठीक है, जैसा कि आपने कहा बच्चा आपस में बात करते हैं तो उनको भी करने का मन करता है। ठीक है, मान लीजिए कि आप लगातार 1 महीने तक योगा करा रहे हैं एक ग्रुप को और एक बच्चों के ग्रुप को नहीं करा रहे हैं। ठीक है, तो ऐसा नहीं होता कि जो दूसरा ग्रुप जो योगा कर रहा है, मान लीजिए कि उसने सिर्फ 1 दिन के लिए योगा कर लिया, तो वो मतलब यू कैन नॉट कंसिडर दैट एज कंट्रोल ग्रुप। ऐसा नहीं होता है। मतलब 1 महीना योगा करने में और सिर्फ 1 दिन में आधा घंटा 1 घंटे योगा करने में फर्क है। वो सिर्फ 1 घंटे का योगा पूरे उस महीने में क्या है, कोई असर नहीं डालता है। ये पहली बात। दूसरी बात, जो आपका कंट्रोल ग्रुप है बच्चों का जो योगा नहीं कर रहा है, उनमें से मान लीजिए कि आपके एक ग्रुप में 20 लोग हैं, एक ग्रुप में 20 बच्चे हैं। ठीक है, तो जो 20 बच्चों ग्रुप योगा नहीं कर रहा है और जो दूसरे ग्रुप से बात भी करेगा, ऐसा होता नहीं है। कि 20 के 20 बच्चे जो है इंटरेस्ट लेके योगा करना शुरू कर दे, ऐसा नहीं होता है। उसमें से हार्डली 1-2 बच्चे योगा करेंगे, और क्या वो लगातार 1 महीने तक करेंगे? नहीं करेंगे, ठीक है। और जो करेंगे सही करेंगे, नहीं करेंगे, क्योंकि उनको नहीं पता कि कैसे करना है, कोई सिखाया नहीं, राइट। सो आप कंट्रोल शब्द को लिटरली मत लीजिएगा। और जब कंट्रोल ग्रुप की बात करते हैं और उनको योगा ना कराने की बात करते हैं, तो कितना योगा करना और क्या क्या करेंगे तो क्या होगा, ये सारी चीजें हैं। मतलब ऐसा मैंने कहा कि 1 महीने में 1-2 दिन योगा कर लिया, क्या आप ये कह सकते हैं कि 2 दिन का योगा करना और 1 महीने का लगातार योगा करना विल बी सेम? नहीं, क्योंकि 2 दिन का योगा करने से पूरा महीना इफेक्ट रहेगा नहीं रहेगा, राइट। सो इवन बच्चा जब प्रैक्टिस करते भी हैं तो हार्डली 1-2 दिन करते हैं, राइट। मान लीजिए कि 20 बच्चों के ग्रुप में 2 लोगों ने लगातार 1 महीना किया, जिनको नहीं करना चाहिए था वास्तव में, ठीक है। उन्होंने मान लीजिए कि कर लिया पूरा 1 महीना, या मान लीजिए कि 15 दिन से भी ज्यादा कर लिया, तो आप क्या करेंगे? सिंपली अपने एनालिसिस से उन 2 बच्चों को आप एक्सक्लूड कर देंगे, उनको निकाल देंगे, उनको निकाल के आप एनालिसिस करेंगे, ठीक है। सो दिस इज हाउ यू शुड, राइट। So I'll go to next. Yeah. So longitudinal study design. Okay. Longitudinal study design are one of the toughest to do. जैसे नाम ही बताता है, longitudinal मतलब लंबे समय तक। तो इसमें क्या होता है, लॉन्गिट्यूडिनल स्टडी डिजाइन में हम और एक शब्द यूज करते हैं, फॉलो अप स्टडी करके, ठीक है। तो फॉलो अप स्टडीज को भी आप एक तरह से लॉन्गिट्यूडिनल स्टडी समझ सकते हैं। बेसिकली क्या है कि आप योगा ट्रीटमेंट दो एक सेट ऑफ पीपल को, मान लो 10-20 लोगों को आपने योगा ट्रीटमेंट दिया, ठीक है। लेकिन आपने कब तक दिया? मान लीजिए आपने साल के लिए दिया या 2 साल तक के लिए दिया, ठीक है। और आप उसे 2 साल तक लगातार उसको मॉनिटर करते हैं। फॉर एग्जाम्पल, जैसे कोई डायबिटिक पेशेंट होता है, मान लीजिए कि आप उनको योगा करा रहे हैं 2 सालों तक लगातार। जैसे कि हफ्ते में मैं आपको 4 दिन योगा कराऊंगा और हफ्ते में 4 दिन आपको 2 साल तक कराऊंगा, ठीक है। और हर 3 महीने में मैं आपका ग्लूकोज लेवल चेक करूंगा, कोलेस्ट्रॉल लेवल चेक करूंगा, आपका बीपी चेक करूंगा, आपका ईसीजी चेक करूंगा, आपके हार्ट की हेल्थ ठीक है कि नहीं, ठीक है। तो मैं हर 3 महीने में 2 साल तक लगातार आपके पैरामीटर्स लूंगा, ठीक है। और 2 साल तक लगातार हर हफ्ते 4 दिन आपको योगा प्रैक्टिस कराऊं। सो दिस इज व्हाट लॉन्गिट्यूडिनल स्टडी इज, कि आप कुछ पैरामीटर्स, कुछ वेरिएबल्स को असेस करो एक लंबे समय तक, ठीक है। दिस इज लॉन्गिट्यूडिनल स्टडी। और फॉलोअप स्टडी भी लगभग इसी इसमें आता है। फॉलोअप में क्या होता है, 2 तरीके के होते हैं, ठीक है। फॉलोअप में क्या होता है कि आप, वो भी एक तरह का लॉन्गिट्यूडिनल स्टडी ही है। मान लीजिए कि आपने योगा प्रैक्टिस कराया उनको सिर्फ 3 महीने के लिए, ठीक है। फॉलोअप किसको बोलते हैं? आप ये देख रहे हैं कि 3 महीने के बाद वो क्या कर रहे हैं, क्या वो योगा कंटिन्यू कर रहे हैं, ठीक है। तो आपका मान लीजिए कि स्टडी का पूरा ड्यूरेशन जो है 1 साल का है, ठीक है। पूरा स्टडी का ड्यूरेशन 1 साल का है, लेकिन आप योगा उनको खुद जो कराएंगे वो सिर्फ 3 महीने कराएंगे या फिर 6 महीने कराएंगे, ठीक है। तो 6 महीने के बाद आप क्या करेंगे? 2 तरीके कर सकते हैं आप। 6 महीने के बाद आप ये करेंगे कि you won't give them the practice, you won't teach them yoga, okay. Rather you will see after finishing 6 months of intervention what is the sustenance effect of that intervention, meaning after 6 months they won't practice any yoga, but you will take the parameters, okay. You took the glucose level at the first 3 months, then at the 6th month, then at the 9th month, and then at the 12th month. So from 6 months to 12 months they are not practicing, but still you are taking their parameters to check what? To check what did this 6 months of practice had an effect, what kind of effect it had, okay, after 6 months, even when they were not practicing, okay. This is one of the examples of follow-up. What is another kind? You will see कि after 6 months whether they continued the practice or not, right? If they continued the practice, what was the frequency of practice, right? And if this was the frequency of practice, what was their glucose level, cholesterol level, ECG and all, whatever variables you are assessing, right? So when the follow-up comes into picture, it comes into picture when your active duration of giving intervention ends, but still you continue to observe the patient or the participant even after you actively finished giving intervention. Okay, so follow-up study is kind of a longitudinal study, but it is not necessarily longitudinal study, and longitudinal study is not necessarily a follow-up study. Okay, any questions?
भैया मेरा क्वेश्चन है,
हाँ,
क्वेश्चन ये है भैया कि फॉलोअप में, जैसे मेरी स्टडी भी फॉलोअप है आपको पता है, तो एक हम स्ट्रिक्टली बोलते हैं कि आफ्टर 3 मंथ्स एक है कि हम लोग इंटरवेंशन आपको देना बंद कर दिया, लेकिन बहुत सारे बच्चे हलचल हो जाते हैं योगा प्रैक्टिस करने के लिए, वो अपनी प्रैक्टिस कंटिन्यू करेंगे, ठीक है, हाँ कुछ 20-30% करेंगे कंटिन्यू, हम 3 महीने से 6 महीने से उनको करवा रहे हैं, तो क्या हम स्ट्रिक्टली हमारी ये गाइडेंस होगी कि नहीं कोई प्रैक्टिस नहीं करेगा, या उनके ऊपर ही छोड़ दिया जाएगा आपकी मर्जी लेकिन हम नहीं करा रहे, क्या इसमें राइट मेथड क्या रहेगा?
Okay, so ethically you are not supposed to impose on participants कि क्योंकि हम चाहते हैं हमारी रिसर्च स्टडी के लिए कि आप 6 महीने के बाद प्रैक्टिस मत करो, इसलिए आप प्रैक्टिस मत करो, ठीक है, आप उनके ऊपर इस तरह का दबाव नहीं डाल सकते. बट व्हाट यू कैन टेल कि दिस इज हाउ द स्टडी इज, दैट वी वांट टू विल गिव यू इंटरवेंशन फॉर 6 months. आई एम गिविंग अ हाइपोथेटिकल एग्जांपल, ठीक है, तो 6 महीने हम आपको देंगे और हम जानना चाहते हैं कि 6 महीने जो आपने प्रैक्टिस किया है उस प्रैक्टिस का इफेक्ट कैसा रहेगा. तो इट विल बी यूजफुल इफ यू डोंट प्रैक्टिस आफ्टर 6 months, राइट? आप उनको बता सकते हो बट आप उनके ऊपर दबाव नहीं डाल सकते, राइट? सो ऑफकोर्स कुछ लोग जो है, सम पीपल विल कंटिन्यू द प्रैक्टिस, some people will not continue the practice. So what about some people who continue the practice? Obviously, you will have to exclude them from your study. So if you exclude them from your study, what happens to your sample size? It reduces, obviously, right? Then it won't fit your statistical analysis. So what you have to do, that's why research design comes into picture, that you always take relatively more sample than the calculated sample size. If your calculated sample size is, for example, 50, then you will take around 65 to 70 samples, okay, for your study, so that if somebody discontinues the intervention or does not give you the data second time or like this, even if you have requested them, remember this word, requested them, not instructed them. निवेदन किया है, ना ही आपने निर्देश दिया है. These words are important. These words are important in ethical practice of research. So even if they practice the yoga practice, even if they practice yoga after 6 months, even though you have requested them not to do, then in those cases, there's extra sample size that you have taken, okay, that will be beneficial for you, because even if you exclude those samples, you will have sufficient sample size to analyze your results. Okay. So next
question, Riya. What is the minimum criteria of the longitudinal study? Means कि 3 months, 6 months, 1 year, किसको हम longitudinal बोल सकते हैं? Minimum क्या हो सकते हैं?
See, there is no prescribed definition for it as such. Okay, but what's the general practice in research? Generally, 3 months intervention or 6 months intervention, we call them as long-term interventions. Okay, 1 month intervention, 45 days, 2 months, 1 month of 45, like short-term intervention. Okay, or even 1 week, 2 week, short-term interventions. So more than 1.5 to more than 2 months, like, or 3 months, it's like long-term intervention. 6 months is long-term. So whenever you speak of longitudinal study, right, we assume, or we as a research community, not me personally, but as research community, we usually, our brain goes into like at least a year time period, right? At least a year, we think that. So yeah, but there is no set definition for it. So we think at least 10 months or a year or 1.5 years, 2 years, like that. Okay.
Okay, भैया, thank you भैया, thank you so much.
Okay. So this is longitudinal study.
Sir, I have one question on this. So, as we'll give 6 month practice to them. After that, some of the people will do the practice, some will not continue the practice. So, those who are not continuing the practice, as practice, they will consider it as a control group anyways, or some other control group will have.
No. In longitudinal study, okay, when you do a longitudinal study, right, for all practical purposes, you usually operate only with one group. Okay. I'm not saying that you can't have two groups. You can have two groups. But practically, in the process of executing research, it is very difficult to have multiple groups and conduct a longitudinal study on them. Okay. Because it is very difficult to follow the same person for example, 1 year or 2 years, and convince the same person to give you data multiple times. So it's not easy. Okay, that's why when it comes to longitudinal study, even lesser number of sample size is good enough. Like 8 people, 10 people, 12 people with only one group. Why? Because you are following up with them continuously for a year, for 2 years, for 3 years, for 5 years. There are some longitudinal studies that are 12 years long. 12 सालों तक study किया है on the same people, right? So, but they do that only on 6 people, 7 people, 10 people, right? So following up with 100 people is very difficult compared to following up with 10, 12 people. And it's not about sample size. It's also about the data points, right? So even though there are only 10 people, for example, for a year, okay, and you have 4 data points in 1 year, every 3 months, one data collection, okay? So imagine the data points, you have 40 data points. So 4 data points for each person. So for 10 people, you have 40 data points, meaning you have 40 data points to analyze. Now consider RCT, randomized control trial, right? You have 2 groups. Even if you give a long-term intervention 6 months, right? Even if you take 3 data points, first month, third month, 6th month, okay? So 3 data points for 2 groups. How much it is? 6 data points, right? So there are 60 people, but they have only 6 data points. Here, you have only 10 people, but you have 40 data points. So data is very rich.
So, sir, the people who are doing practice afterward and some not doing, they will considered as the two other sets, the sets will exclude them, those who are not practicing afterward. What will do
Okay.
about different situations are there now?
Yeah, so what I'll give you an example. So considering that you have one group of 10 people, for example, 20 people, you are doing a longitudinal study for a year, okay, and you give an intervention for 6 months. And after 6 months, for example, those 5 of them, out of 25 of them, you requested them that you please don't practice, but 5 of them still practiced, okay? Now what you will do, you do not consider them as control group. You will simply exclude them from your analysis. Done and dusted. Kaam khatam.
Okay,
There
sir.
is no question of control group arises.
So,
Okay.
sir, one more question. Like
Yeah.
in a follow-up study, for example, we have given intervention for 3 months, and another 3 months we want to do follow-up study. But in that case, some extraneous factors like some people have started job, changed job, some stress level might be there. Other factor maybe they've shifted. So in that case, how we can control?
Okay. So that's question not particular to follow-up study. That is part of your designing of research. Basically, it's about inclusion and exclusion criteria of your samples. Okay. How have you decided what are the characteristics that you decide to include in a participant? What kind of characteristics that you decide to exclude in a participant? What kind of data you decide to take from that participant, right? For example, if I say that after practicing 3 months of yoga practice, diabetic people reduce 5 kilos of weight. Okay. But when you look at the baseline data before practicing yoga, okay, when you look at their BMI, for example, okay, some of them were obese, some of them were overweight, some of them into normal BMI. Okay, you haven't, and you are saying collectively that on an average they reduce 5 kgs. But it's a wrong assumption, wrong data. Why? Because you are considering the different category of BMI all into one, where it's not the case. So like that, even if it's a follow-up study, RCT, whatever study it is, whatever study design it is, okay, it's not a question of follow, rather it's a question of what are the inclusion and exclusion criteria and what are the information that you're collecting from the participants, okay, that helps you to interpret your results. Okay, so these questions pertain to that aspect, that what are the kind of information you are collecting from. So for example, I gave you the example of reducing weight. If I had not collected the data about their BMI during the initiation of the study, okay, I would simply report on an average 5 kilo reduced. But when I bring BMI into picture, then I can say, no, with people who had a normal BMI, only half kg reduced. With people who had overweight, 2 kg reduced. With people who had an obesity range of BMI, they reduced 4 kilo. Right? So you understand the difference here in the context of the information. In the context of the information of BMI, how your interpretation of your results changed. So it depends on what kind of information you are collecting. That's called, sometimes those information are demographic information, like their height, weight, the location where they stay, their ethnicity. Sometimes ethnicity becomes important for genetic predispositions, right? So, and their socioeconomic level, their lifestyle habits, whether vegetarian, non-vegetarian, whether they're alcoholic, non-alcoholic, these kind of, we call them as demographic informations. Sometimes these demographic information helps you to control these factors statistically or interpretation wise. Okay, sometimes other factors also, sometimes other kind of information also. Okay, so these are the kind of information that help you to interpret your results in more efficient way. Okay.
Okay, sir.
Okay, self as control study design is nothing but you have only one group. There are no two groups involved here, but the same group will receive two interventions. For example, here the group that is receiving the intervention itself serves as a control group. Okay, so for example, if there are 10 people in the group, they will first have a 1 week of yoga practice. Okay, and after 15 days, they themselves will have, for example, exercise practice. There are no other people in the same group will practice exercise. Okay, but here the point is that it's only one group. Okay, or but here there's no active control, so I shouldn't have given you the active control example. So basically, one group practices yoga, the same group will just stay stable for another week, or else first they will just spend their 1 week as it is, nothing much, but after 15 days they will practice yoga. Right. So what it serves, what purpose does it serve? It's basically saying that, see, the same group of people, when they did nothing, this happened, but the same group of people, when they did yoga, there were some changes. So since the population is same, since the sample is same, there is only difference in intervention, right? So this is an effect of intervention, you can simply claim. So this is as self-as control design, but this study design is very less. You will see very hardly few papers on this design. Okay, but it's not usually recommended to use this design. Okay, in a PhD research study, this study design good for a pilot study. Okay, where you want to just do a mini study to get an idea about your main study. Okay, these are good for pilot study design. That's fine. Don't include for your like PhD research. Okay, it's not recommended. Now coming to correlation study.
So, sir, this will be like pre-post design only, now, because normal condition we are taking their results, because in pre-design
Yes,
also, and
it will be
normally they are
like
not practicing anything. In pre-design also, they are not practicing anything. Then we are taking their data, and after
yes.
giving them intervention, we are taking their data. So, what is the difference between pre-post and self-as control?
In that sense, an RCT, randomized control trial, longitudinal study, self as control study, okay? To some extent, correlational study. All these are pre-post study designs. In randomized control also, you take pre-data and post-data. Longitudinal study also, you take pre-data, post-data, right? But here, the difference is in the population in the sample. In RCT, you have two different groups from the same population. Okay. In longitudinal study, for all practical purposes, you usually operate from only one group, right? In self-as control, you have the same group, but it itself serves as a control group. There is no other group. It's the same group. Okay. So wherever you take pre-data and post-data, that everything is pre and post study design. But how you divide the population and the groups, that makes a difference. And how many times you're taking assessment, and what's the duration of your study design, what's the duration of your study, or what's the duration of your intervention. Okay, these are the things that create difference in the study design. Okay. So now the correlational study. Okay, correlational study can be in two ways. Okay, fundamentally, correlation studies are basically to see whether two things are associated or not. Okay. For example, I will check whether the experience of yoga practice is associated with reduced stress level or not, whether there is an association or not. Okay, I want to check. So what I'll do, I'll take people who are already practicing yoga. Okay. For example, I'll contact people, please tell me since how many years or months you are practicing yoga. Okay. And I'll also give them probably a stress scale that assesses their stress level. Okay. And they will say, for example, some people will say 5 years, some people will say 10 years, some people will say 2 years, some people will say 6 months, some people will say 20 years. Okay. And they will rate their stress levels. Okay. Now what you will do, you will do a correlation analysis between these two data sets. Okay. And you see whether there is statistically any correlation or not. Okay. So when you check this, for example, you got the data tells you that the higher the experience of yoga practice, lower the stress level. Okay. So there is an association. It's called a negative correlation. Higher the practice, lower the stress level. It's a negative correlation. Okay. So on the opposite side, if I say higher the practice, higher the experience of yoga practice, more is the person relaxed. Okay. Higher the experience, more relaxation. So this is a positive correlation. Okay. So this is correlation study where basically you are trying to find whether there is an association between two variables. Okay. So that's a correlation study. Next is, yes, any question?
सर
Okay.
ये केवल उन्हीं लोगों के लिए तो नहीं है ना कि जो पहले से योगा कर रहे हैं प्रैक्टिस, किसी के उसमें भी दो चीजों के बीच कोरिलेशन निकाल सकते हैं ना?
हाँ, निकाल सकते हैं, मैंने सिर्फ एक उदाहरण दिया आपको, ठीक है। कोरिलेशन आप किसी भी दो वेरिएबल के बीच में निकाल सकते हैं, ठीक है। किसी भी दो वेरिएबल मीन usually it is between independent and dependent variable, but in some cases you can also establish a correlation between two dependent variables also. Okay. So quasi experimental design में क्या होता है, it's like a जो सेल्फ एज कंट्रोल बोला ना मैंने, ये वही है, ठीक है। दो टर्म अलग अलग है, ठीक है। क्वाजी एक्सपेरिमेंटल डिजाइन ये टर्म जो है अभी ज्यादा आ गया है। सेल्फ एज कंट्रोल डिजाइन पहले यूज करते थे, लेकिन ये क्वाजी एक्सपेरिमेंटल स्टडी डिजाइन अभी यूज करने लगे, ठीक है। बट अभी भी मुझे ना कभी कभी इस लिटरेचर में जब आप रिसर्च स्टडी पढ़ते हैं, ठीक है, तो मेरे ख्याल से डोमेन स्पेसिफिक भी है शायद। इन सम केसेस देयर आर sometimes it overlaps with crossover study design. Sometimes it is as typically as self-as control design. Okay, so I think it's domain specific also कि आप किस एरिया के रिसर्चर, आप सोशल साइंस के हो, ह्यूमैनिटीज के हो या लाइफ साइंस के हो, right? So I think it's more dependent on that also. But sometimes this study design term quasi experimental, Sometimes it's overlap with crossover, sometimes it's self as control, right? So don't get much confused with self as between self as control and quasi experimental study design. Okay. So now systematic review and meta-analysis. So both of these things are not exactly the study designs. But why did I include these things is just because for publication from a point of view of reading paper. Systematic review is one way of writing paper. It's also a design, but it's not a design to conduct research, but rather reporting your research findings. It's a way of reporting research findings. So systematic review, there is a guideline called PRISMA guideline. Okay. So you follow that guideline. According to that guideline, you gather your data and you have to report that data. Okay. There's a clear-cut guideline that how you have to write a systematic review. Okay. This is not a design with respect to conducting research. It is a design with respect to writing paper. Okay. And there's another meta-analysis. Meta-analysis is similar to systematic review, but meta-analysis involves huge statistical analysis. Okay. In systematic review also you gather multiple studies and see what are the outcomes in different studies, and in a way you summarize the outcome of different studies. Okay. But there is no statistics involved in it. You just conceptually or physiologically summarize the different findings of research. In meta-analysis, what happens? You basically take the statistical outcomes of different studies and you do a pooled statistical analysis of different studies, and then you come to a conclusion that this is how these are the different outcomes of these are different statistical outcomes of different studies. And when you look at these different statistical outcomes in a collective manner, this is what the outcome is. So meta-analysis is more of a from a statistical point of view. It gives you collective statistical data of different studies. Systematic review gives you more summarized findings of different studies. Okay. So these, yeah.
What is there like minimum number? Like for example, if systematic review of some articles or meta-analysis of some articles, so is there any limitations like you should have at least this much of articles? Research should be reviewed. Like 10 research, 20 research, 30 research, 100 research. Like, is there any limited area like meta? At least you should have more than 10 research or more than 20 research. Like that, any limitations in that?
In both systematic review and meta-analysis, the more the studies you have, the more it is better. Simple rule. Okay. But what's the minimum size? There is no minimum size as such. Okay. But
because I've read one article in that panel graph, they cannot do if there is a less than 10 RCT. They have done on RCT. So from that point of view, is there anything? This is one article I've studied in that. But there may be another parameter of statistics that in that is minimum requirement is there.
So that's what I was explaining, that there is no defined limited minimum number of studies. There is no definition of it. Nobody has defined it that this should be the minimum number. Why? Because there are many variations. The domain specific studies, for example, there are, as I said, there are social science studies, there are humanity studies, there are life science studies. Okay. So each domain of subject have different complications, have different nuances. Okay. So, and for example, you want to study cognition, for example, right? You can assess their attention in all these levels, what the memory levels, simply by a paper pencil test. Okay. Or you can use sophisticated instruments as MRI, EEG, fMRI, okay, all these instruments, and assess their brain functions as of how their cognitive function is, what their brain reflects with respect to their cognitive functions, right? So some studies of some fields are rare to find, okay, but there are some variables that are widely studied. For example, perceived stress. Okay, this is one of the widely studied variable across different market research, corporate office research, okay, management research, yoga research, psychology research, like widely studied variable. Okay, there are like thousands of papers. So in this case, if you want to write a systematic review about perceived stress, and if you take only 10-20 studies, nobody is going to accept your paper, right? They will expect at least you should have included 150 papers, 200 papers, like that. But for example, I wrote a systematic review. Okay, I wrote that on EEG and cognitive studies in diabetic patients. Okay, I found there are only how many? Around 12, around 15, 16 papers, I guess. Okay, not more than that. Why? Because there were not much studies done on it. But I included every single study since 1980s. Since 1980s to 2021, whatever the studies were there within of my topic of the within the framework of my subject of systematic review, I included every damn study. But over a period of 30 years, there were only 16 studies that have been done. And that's why it was accepted, because there were no more studies on it. So what does it convey? It conveys one thing, that no much research is done on this, but there is more need to be done on this. So it depends on the field, your domain that you have chosen to write, or you're writing on some tools, or you're addressing some specific variable. So these are the factors that will decide that how many papers are good enough. One thing. Second, where do you want to publish it? Okay. For example, if you include 25 papers, okay, certain journal will accept it, certain journal will not accept it. Okay. So it also depends on which journal you have targeted to publish. Okay. So journal that you want to publish, the domain, the tool, the variable that you're addressing, all these things impact your decision of including papers. Okay.
Another thing is, like in a systematic review or meta-analysis, if you see what I've read in the articles of like this, like they have, big chunk of articles, then they, in the console diagram, they reducing, and finally 137, yeah, 400 they've taken, and finally they come to 9 research only, or 10 research only. So that,
Correct.
That also, that detail usually not there in the article, very much detail. So what are their criteria, duplication, or what they use to find out these all things to exclude this
In consort diagram, they must specify how did they exclude, at what stage they excluded the data, excluded papers. They must specify.
Like for duplication, so duplication, how they decide on duplication? So many articles excluded due to duplications,
Yeah, correct. They do exclude. So what your मतलब आपका सवाल क्या है इसमें?
Like how they find out, like duplication, exactly duplication, how they find out?
Okay. So it's a very it's again a very long discussion. Okay. So when you basically try to do systematic review, basically search for papers, and the keywords that you use, that basically based on keywords, database search your paper, right? And since you are given some keywords, that will obviously give certain papers, and you are not taking papers from only one database, from 2, 3, 4 databases. So obviously you will have overlap of papers. So that's why that's a duplication of papers.
Okay, in that sense only, like Web of Science or Scopus, same data has come. That is the duplication, or itself research is the duplicate here?
No, if it is a duplicate research, simply papers journals won't accept. It's the basically from different databases that you have searched. That's why there's a duplication.
Acha, and another question is, in meta-analysis, there are some graphs, they give like biased data or authentic data or something. They make a graphs also. That they make on what basis?
Statistical analysis. They do pool statistical analysis.
Okay, thank you, sir.
Yes.
Sir, one thing that exactly I'm not understanding, that what is the difference between systematic review and meta-analysis? Is it the differentiation is it is qualitative and quantitative? Because you're saying that it is statistical, it is quantitative.
No. It's not qualitative, quantitative. It's that in systematic review, you are not talking anything about statistical analysis. You're not talking anything about, you're not presenting the outcome of those studies in terms of statistics. Okay. You are saying there were 20 studies, and in 20 studies, 15 studies found that yoga reduced their sugar levels. In 5 studies, yoga did not reduce sugar levels, but there was reduction in cholesterol level. Okay, and among 20 studies, 5 studies also checked their, BP, but 15 studies did not check their BP. But you won't tell that sugar level reduced from 8 to 7, and BP reduced from so and so to so and so. You won't talk in terms of values. Okay, you talk in terms of the concepts. You talk in terms of interpretation of results. Okay, in meta-analysis, you talk only numbers. So this was the mean value in this paper of glucose value. Okay, in second paper, the glucose level mean value was this. In third paper, the glucose level mean value. So like that, 20 studies. Now you take the mean values of all the studies and you do a pooled statistical analysis of all the 20 studies. Then you come to one statistical value. And what would value mean? That you explain in meta-analysis. So meta-analysis, you do analysis, statistical analysis. You talk in terms of numbers. You talk numbers. Systematic review, you talk interpretation of those numbers.
Yes, sir, understand. Thank you.
Okay, I suppose we are done here, or if you have any questions, I am like.
Sir, another you said in RCT also, you said like one control group or one experiment group, and in control group, usually we request them not to do, if it is a yoga intervention, we tell not to do yoga or something. But nowadays, ethical things are coming day by day, strong impact on research. So even some of the disease, ethically, even requesting them not to do exercise yoga, it's also unethical. So in that case, what should be considered?
No. When you plan your study, right, you propose that, for example, RCT, and if your plan is to give yoga practice to one group and not to give yoga practice to one group, okay? So it's not unethical to request that. And if somebody is saying, no, I want to practice yoga, I don't want to leave yoga practice, so you do not include such participants in your study. So that is called screening. Okay. So first you screen the participants, whether they fall into your inclusion and exclusion criteria or not. Okay. And if they are falling, then you explain them the study. So this is how study goes. Are you willing to comply with the study design? Okay. Or do you think that you will be able to comply with the study design? Okay. Some people think that they will be able to, and later they think, no, I can't. Okay. So you simply exclude them from your study. Okay. Some people do comply with your study design, right? So that's completely ethical. If somebody initially says, no, I don't want to comply with this study, right? They're free to not participate. That's okay. Fine.
Sir, as per the PhD point of view, there is any limitation कि यूनिवर्स हम किसको लें या कितने पार्टिसिपेंट्स होने चाहिए? सपोज अगर हम कोई योगा इफेक्ट किसी एक पर्टिकुलर कॉलोनी बेस्ड पीपल्स पे करना चाहते हैं, तो इसके लिए कोई क्राइटेरिया है क्या रिसर्च डिजाइन में कि हमें इतने पीपल्स को इंक्लूड करना होगा?
जी हाँ, आप कोई भी रिसर्च टॉपिक ले, आप किसी भी पॉपुलेशन पे काम करें, कॉलोनी के लोगों पे, स्कूल के बच्चों पे, हार्ट पेशेंट, डायबिटिक पेशेंट, हाइपरटेंसिव पेशेंट, कॉग्निटिव पेशेंट, साइकोलॉजिकल पेशेंट, किसी भी पॉपुलेशन पे काम करें, देयर इज ऑलवेज अ कैलकुलेशन कि आपका जो स्टडी का हाइपोथेसिस है, आपके स्टडी का जो ऑब्जेक्टिव है, आपकी स्टडी का जो रिसर्च क्वेश्चन है, ठीक है, उसके हिसाब से आप कितने ग्रुप रखेंगे तो आपके लिए फायदा रहेगा, ठीक है, और कितना सैंपल साइज सही रहेगा आपके स्टडी के रिजल्ट्स को जस्टिफाई करने के लिए. So that's we call as calculation of sample size. So there is a way to calculate sample size. Okay, that will tell you how much sample size will be good enough for you to justify your outcomes.
Thank you, sir.
Sir, nowadays quasi-experimental is quite. I'm seeing in so many articles. So in that also there are so many varieties. There is a
Yeah.
one group, two group, and everything. So what is there that criteria?
So basically, that's what depends. As I said, what's your hypothesis and objective of your research? If your objective of research is basically to see that if particular person practices yoga as well as exercise, okay, how yoga is different than exercise, how yoga is affecting his probably the heart rate or lung function, and how exercise is affecting his heart rate or lung function, right? This might be your research question that probably you want to explore this, or probably your research question is like, I want to see that if particular population practice this, right, for this duration, and same population practice this, but the other population also practice both of things, right? So what happens to them? So the nuances that are there, the small elements, the small differences that you see within the same study design are because of how they frame their objectives and research question and hypothesis. Okay, so when we talk about research design, right, as I said earlier, it very much is dependent on what is your research question, aim of study, objective of the study, hypothesis of your study. It's very much dependent on that. Okay, so you cannot see your objective and hypothesis isolated from your, in isolation from your research design. You can't do that. So your research design should be able to answer your hypothesis. It should be able to answer your achieve your objectives of research. It should be able to answer your research question. That's why research design is prepared.
Another thing, sir, like RCT, we call it RCT. In that, only randomization in like if you have two groups or three groups, so you are randomizing in three groups. That is only concern, or either first of all selecting total number of sample from population. Both should be RCT, or you only randomization in group. What will be the difference in that?
Randomization means dividing people into groups. Randomization does not mean deciding how many people should be included. How many people should be included will be decided based on your sample size calculation.
That's fine. Once its sample sizes come, but that sample size is randomly you have to take from population, or only reported people like that. That difference I want to know.
Sorry, I did not get your question. So once you
Like
have population,
for example, anybody wants to take any disease from one city, for example. So in that person have a two possibility. Either they get all the disease people in one city, or maybe whatever they found themselves through whatever hospital or clinics. So that randomization in a two step. First is what population data they've got, and out of that again randomly they've sample size decided, and that sample size also like randomly you have to select from like 50 for my sample size. I have to select randomly from the population, and then out of that my criteria fulfilled, and then randomized in three groups. So first stage and second stage. So both should be randomized, or only second stage you can randomize?
no. See, first we calculate sample size. Then what happens? Whoever comes, for example, you are taking diabetic patients. When the diabetic patient comes to you, even from one single city or two different city, or from one single hospital, two different hospitals, basically first you screen them. Okay, that whether they fall into your inclusion exclusion criteria or not. If they fit into your study, okay, then like that you will screen all the participants that you have gathered, right? And once, for example, you have samples of 20, okay, 20 people from different hospitals of the same city, okay, and for example, you have generated a random sequence in computer, okay. So now you see whom you have given number one, number two, number three when you are screening the parties. For example, day one, two people came, okay, and two fitted into your study. You gave them 1 and 2 number. Second day, 10 people came, but only 6 people were eligible in your study, and you gave them number, okay. And in computer, you have generated 20 numbers. 10 people in each group, and you see where the number 1 is falling in which group, number 2 is falling in which group, right? So then once you have taken 20 people, you see that where those IDs are falling into which group. Then that's the randomization is done.
Okay.
Once your
So,
population
for
is
example,
decided,
yes. For example, my topic is multiple sclerosis patient. So in
yes,
Ahmedabad, I am in process of I've 3 places I've got the data right now, and still I'm searching. Like imaging center I got, one hospital I got, and one clinic I've got. So till now I've got only 22 data, and still I'm in process. So whatever data, the first steps I should do the inclusion exclusion criteria only. First, you mean to say?
what do you mean by you got data?
Like data means phone number, address, and that detail I got for
Yeah,
MS
first you
patient.
have to check whether they fit into your study or not.
So first I
Yes.
have to matlab decide inclusion as per inclusion exclusion criteria,
Yes,
right?
basically you have
And
to screen.
then screen out, yeah. And after that whatever the numbers remains, in that I have to do the sample size, or previous data what I got, in that I have to do the sample size.
No. Finally, the people who fit into your study, you have to divide them randomly.
Okay, but then where the sample size, we have to decide sample size also. So that is
You have to
in total population.
No, you have to decide sample size before beginning the study.
So then we should know the population, then only we can decide the sample size.
That's what I said. There's a difference between population and sample. For example, in Gujarat, you're in Ahmedabad, right?
I have decided to study about Ahmedabad only.
Right. So in Ahmedabad, you're studying on multiple sclerosis. So for example,
Yeah.
there are 500 patients of multiple sclerosis in Ahmedabad. Okay. So it's a population of 500 people. Okay. But you want to collect data from all 500 people. You will collect data probably from, for example, 100 people. That 100 people is your sample. Okay. For example, you calculated a sample size for 2 groups.